This is another ad hoc, tough video, tell a friend video on the danger that lies in corona. So what are the characteristics that make corona very unpredictable, so as compared to a normal influenza? I call it a flu. So you have corona and the flu. And now, in general, they are very similar. You could say, well, you fall sick and you stay in bed for 2 weeks and it's the same and you have kind of the same pain. However, there are a few differences that makes it unpredictable. A flu usually knocks you out within something like 8 hours. A corona may knock you out not at all, or it may knock you out like within the next 72 hours. And within that period, you are able to actually pass it on to somebody else. With the flu, you would stay in bed. Then corona seems to be transferable easier than a flu, but I'm not 100% sure on that. Then if so, you can have it for a long time. Now the thing is, old and sick people could die. I think that is kind of the same in both. But for one thing, if you have a condition on lung issues, lung or heart, yeah, and diabetes and so on. So it actually, that makes it more mortal on this side than on this side. Maybe factor, I don't know, 3, something like that. Then exactly, and the thing is, if you fall ill, you need oxygen, you need intensive care. Yeah, so I would say these 3 things make it. There are some more, but these 3 things are very kind of characteristic. So instead of kind of staying in bed after you get infected with corona, you run around for another 3 days and you pass it on to many other people, and then you may fall ill. But not all. Then I would say, if you have precondition, the likelihood that you die of corona is maybe 3 times or more higher when you have corona rather than an influenza or flu. And also when you have corona, you need oxygen, intensive care and so on. So here the places in hospital are limited. Now that means this is the challenge to the health system. Yeah, and now the question is, why are there some countries that actually have huge problems? So let's say Italy. And for Italy, if you analyze Italy, then you would see that in many of these villages where there are lots of casualties, they're rather old, so greater than 80 years, yeah, the population. And then usually you're not fit, and usually when you hug and kiss when you meet your relatives or friends, so that means you pass it on very, very easily. Yeah, the other thing is the USA, for example. There a lot of people are fat, a lot of people have diabetes, a lot of people are not fit, same as in Italy, and in many cases the immune system is weak. Why? That is because we take a lot of medicine, we take a lot of antibiotics, we disinfect everything, everywhere, alcohol, and so no germs and so on. So that means you have an immune system of the population, general population, that's very, very week, I would say. And then a few people go to the doctors, they just take some pills, so you might discover corona relatively late. And that is why Italy and the USA will face these problems. If you, for example, take Korea, yeah, then you have young population, and they are around maybe on average 40 years or low, and then you already have, in Korea this is okay. And now if you take, for example, Germany, yeah, you would say they don't hug and kiss. They're also relatively old, but they always go to the doctor. They are not as fat and as diabetes prone as in the US yet. So, and the healthcare system, health care is very, very good. So people go immediately to the doctors, and so Germany should be okay as well. So what we see with corona is actually that it depends very much on what kind of population it hits, and or it strikes on what kind of population, about the severity, and that makes it so unpredictable. Yeah, or well, maybe now it is predictable. Maybe we can say if you meet old, population and all these preconditions, then corona is actually very, very dangerous. And that means in those countries you might have to do precautions, very, very, very severe precautions and measures, so that the healthcare system will not go out of service, will not be overloaded, and then try to build that up, so kind of slow down the wave, so that maybe in 2 to 3 to 5 months, there's, you have your health system set up, and then maybe you have medicine, maybe that takes longer, and so on. So these countries might run into problems for a longer time than maybe countries that like Korea or Germany. Comments, please, in the comment section, and I'm happy to discuss this. It's an interesting topic, very complex topic, and I'd like to hear comments. Thank you very much for listening, and bye bye.